Hello, in this video I'm going to be talking about the benefits and the myths about early detection of breast cancer. Before I go on, I'd love to have you subscribe to our channel. We put out new content a couple times a week, so there's always something new to watch. So you, like me, may have grown up hearing early detection is the key, not just for breast cancer, but for any kind of cancer. And in general, that's true. The earlier we catch cancer, the more likely it is to be curable and to require less treatment. So we do like to catch cancer early. In people who are diagnosed with small lymph node negative breast cancers, the survival rate is as good as 95% over 5 to 10 years. So that's good news. Early detection, if the cancer is caught earlier, may mean less treatment. It may mean no chemotherapy, a lesser surgery instead of a mastectomy, a lumpectomy. For some people, it might mean you don't need radiation therapy. So in general, it's good to catch cancer early. How do we catch cancer early? Well, the main way is through screening. Screening doesn't actually prevent breast cancer. It's called secondary prevention. What it does is it catches cancer before it can cause as much trouble. And the mainstay of early detection is mammography. Mammography has been studied in people most extensively who are 50 to 75, where we know that mammography can catch cancer early and save lives. In younger people, breast cancer is harder to catch early, and that's in part due to a couple of reasons. The first is the biology of the tumor is just more active, and cancers develop between mammography. And the second reason is because younger women are more likely to have denser breasts, which makes mammography a little less effective. Now, most mammograms today are done with computer assistance, and they're thus more sensitive, but not always likely to be seen on people with denser breasts. The other way we talk about detecting cancer early is through clinical breast exam, where a healthcare professional does a breast exam every visit or once a year, or you do a breast exam on your own. Now, most of the evidence does not suggest that a routine of doing self-breast exam every month improves outcome. You might catch your cancer, and you might catch it a little earlier, but by the time it's felt by somebody on their own in the shower or once a month, they're doing their self-breast exam, those cancers tend to be larger and not as vulnerable, or they don't count as early detection, and most people will end up needing the exact same type of treatment they would have if they'd had it done detected through mammography. This is not to say you shouldn't do it, and it's not to say that you shouldn't pursue medical care if you find something abnormal. Many of my patients have found their own breast cancer. The hard thing is that if you didn't do self-breast exam, to have the culture tell you you messed up, you missed your breast cancer, you didn't pick it up, you somehow failed. So it's really important not to feel like this is what the evidence says, I have to do this. It's actually never been shown to be helpful in large trials. In general, the people who find their cancers on breast exam did not find it in a monthly exam. They found it when they were putting on their seatbelt and they felt it, or they just felt drawn to that area of the breast because they felt something abnormal, or their partner might have caught their breast exam when they were being intimate. So it's just important that there's not be some message that if you don't do it, there's something wrong with you, and that if you do it, it changes everything. Because again, the evidence is pretty thin. So we, in general, see breast cancer detection spoken about through imaging. Some people are at higher risk of breast cancer, people with an inherited susceptibility to breast cancer, and we tend to do more imaging. You've probably seen our other videos. We tend to do MRI along with mammograms, along with an exam, and that's because in people with an inherited susceptibility, like a BRCA mutation, they have a breast cancer risk of 50% in their lifetime, or even as high as 80% in their lifetime. That's a very different thing from somebody who has an average risk or an increased risk because they're getting older. So there are a couple caveats with early detection. One is that we actually don't have proof in more aggressive tumors that anything we do will catch them earlier other than seeking medical attention when you feel something abnormal. So for example, triple negative breast cancers, other aggressive breast cancers, screening is less likely to catch them. As I mentioned, they're just more active. So let's take the example of other cancers that are more aggressive. So for example, things like pancreas cancer, we need to show in people that screening means that early treatment improves outcomes. And we don't have that for a lot of cancers. We don't have that for cancers that are triple negative. The cancers that tend to be caught with mammogram or monthly self-breast exam are the slower growing tumors. And in many cases, that cancer was so slowly growing that we would have had the same outcome if we detected it a year later. The other thing is we can get false positives. So people can go in and have their breast imaging, their MRIs, and it's likely to show things that aren't cancer. Now they're getting overdiagnosed and overtreated, having extensive surgeries when maybe that cancer wouldn't have affected them in their lifetime. We know this with prostate cancer. With some exceptions, people are more likely to die with prostate cancer than of prostate cancer. And we're probably treating more men than we should with prostate cancer. There's also that concern with breast cancer that your own body could treat it on its own and that you don't need surgery and radiation. At this point, we can't tell who those people are. So once you're found to have a breast cancer, you're going to get treated. We are working on identifying people who don't need surgery. We are always trying to decrease the amount of treatment we're getting, despite the cynicism that some people watching our videos have, that we just want to treat everything. We just need evidence that not treating is okay. And we're getting there with some cancers. We're getting there even with some breast cancers. But at this point, once you're diagnosed with an abnormality, we will go ahead and treat it unless there's a compelling reason not to. You have other major medical problems. And then of course there's the cost of early detection and showing that the cost, your out-of-pocket costs and the costs to the entire health system are going to be well spent, because we don't want to deprive you of other things we know will help you when we don't necessarily have proof that more frequent testing or more intensive early detection improves outcome. In general, when a medical professional is looking at a patient, we don't take into account society's costs. It's more when we come up with policies. I do want to make a special comment about people who are younger and breast imaging in their 40s. So there's some recommendations that say breast imaging should start in the 40s, when we're in our 40s, and that still remains somewhat controversial. There are also some arguments that we should stop doing breast imaging after a certain age, after 75. And there are good arguments to be made for that as well, that people after a certain age, of course, depending on their life expectancy, which is not driven by age alone, can stop getting breast imaging. It's not ageism, it's rather, is this going to improve your outcome? Is this going to help you when we know that older people are more likely to die of other medical conditions and to have more indolent or slower growing tumors? I hope this has been helpful. I know I've covered a lot. Sort of watch this space, because guidelines are changing all the time, and even when guidelines come out, it doesn't mean they're truth with a capital T. We'd love to know your thoughts or questions. Just drop a comment or question below. And as always, thank you for watching.